So, Mr. Lindsay, he serves as Wayne State University's Vice President for Government and Community Affairs, a position he has held since 2012. In his role, he oversees the federal affairs and state affairs offices, working with federal, state, and local elected officials to secure and enhance state appropriations, federal research funding, and other state and federal funding opportunities for Wayne State. Likewise, he manages the Community Affairs Department, very busy man, so thank you for being here, which actively engages the university and the greater Detroit community. And he is a senior pastor of the Greater Bible Way Missionary Baptist Church in Detroit, which we just spoke about, where he assumed the pastorate in June of '92. His role, Patrick cultivates the congregation's spiritual growth and development, oversees the implementation of the ministry's strategic plan, and directs the administration of the church's ecclesiastic and business affairs. Prior to joining Wayne State, he served with Focus Hope as Director of External Affairs and Development and enjoyed a 20-year career at Chrysler, mainly as Senior Manager of State Relations and Manager of Community Relations. His leadership roles, community affiliations, and volunteer activities are many, and he serves on a number of boards and national and local organizations. He has a BA in political science from the University of Michigan. He said he bleeds blue, but he loves what he says. He lives in Detroit, close to here, with his wife Kathy, and has a son Kendall and a daughter Caitlin. So thanks for being here.
Thank you. Glad to be here.
Good evening, everyone. I don't know why they read all that stuff, but I'm grateful to be here. Grateful to be a part of this program. I was asked by Haley Thompson, the good doctor at Wayne State, who asked that I would come and simply give some welcoming remarks for this evening's discussion. And I think it's important to have this discussion, particularly with this esteemed panel that's here. All I can say tonight is facts matter. Science matters, data matters, research matters, and more and more as I go into conversations, not only at work, but in personal conversations, facts don't matter. People are emoting and opinionating, and they have innuendos and rumors that they're relying on. There are racial and social stereotypes that they use to draw conclusions, and then there's just partisan politics and all kinds of ways in which people not only are having personal interaction, but it enters into the marketplace in Lansing and in DC, and sometimes you'll find policy that's made by something other than data or science or research or truth or facts, which is why it's important for those of you in this room, particularly scientists, to do the research and help us to bring some of that data to the forefront, but to get facts and to get what's good about positions that are important. When you think about Detroit, you think about all of the issues that we have here as it relates particularly health disparities, which is what Checkup really is helping to do, and the research that's being done that cures. You need facts to help those like elected officials like Senator Chen, who can help effectuate good policy, because policy helps dictate not only laws and legislation, but funding and other resources. And it's the long game. And so it's important for the science and the research to meet up with the advocates. What a great group of advocates here. I know most of them. And Ms. Bynum, I've heard of your work. Katie, I've watched you in action. Matt, I know what you do with access, and who can say something about Jametta, right? A fearless advocate, taking the facts and the research, having that voice being championed, because you got to translate it. You can't just take, a lot of facts and figures. You got to have people who can translate it, and have great legislative leaders like Senator Chen, there to work with. And so I simply am here to applaud the work of Checkup and Dr. Haley Thompson and her team, those along with Hillary and Carrie and others at Wayne State. but the partners, CVS, who is partnering with us, along with the Detroit Food Policy Network Access, Detroit Parent Network, and others who are helping to make sound policy so that all of us, not just Detroit, but all of us, can lead better lives and have healthier and better outcomes. And so I'm here to just be supportive. We try to help out best we can. And I hope you all have an enriched evening tonight for being here. Thank you.
Thank you so much. You
Well-
made my job a lot easier because what I'm gonna do for us is kind of set the stage before we dive into questions and provide a definition for advocacy. What are we doing here? And how research can do a good job at connecting, right, with advocacy and action and making change. And then here some more ideas and experiences that we can draw on about how we can do that moving forward. So thank you so much, Patrick. Done. Okay, so, I just want to point out a picture, in this, slide here and say that one of the, most exciting things that happened at, in my job as a person that's responsible for connecting researchers with community advocates is holding a community advisory board as part of my work in Cures, where on that community advisory board, we had one of the members that worked in Senator Stabenow's office, and she heard the research and was actually writing research around water policy. And so she came to Wayne State University, she came to iBio, she asked those researchers to present again, because one of her chief of staff, Terry, who's in that picture there, told her about it. She came to iBio and was able to interact with one of those researchers and said, you know, what are the current levels of water pollution and that you're studying? And the researcher doesn't know those answers, right? But we could, we have an environmental health lawyer, advocacy lawyer, Professor Nick Schrock, who's at University of Detroit Mercy, and he was able to connect those questions that a legislator had that the scientist isn't necessarily prepared to answer, but also an advocacy, a person that works in law to be able to fill that gap between science and society. And so these things matter. We think we're holding a meeting and that it's not reaching anybody, but it reverberates. So sometimes if you're a researcher, you might take for granted that you're presenting and someone invites you to present at a meeting or a community event, that reverberates beyond what you think might be happening in that room. And so just a small lesson and my experience that I wanted to share. Thank you. Okay, I also wanted to share a book that I read and that I learned about at APHA. What is that? It's the American Public Health Association. I attended a workshop by the writers of this book. And so I'm pulling some definitions that I've learned through that book. And you can actually access this. There are lots of resources on the APHA website. You don't have to be a member. And if there's anything that you come into in a firewall, I have the resources from attending some of these trainings. And I just want to offer myself as a resource and connecting with some of these if you bump up into any problems. I also want to say, besides that, we're going to share some insight for resources and tools that you can access, whether you're a community member or stakeholder, a policy maker, influencer, researcher, that you can access through the Checkup website and also Cures website, so that you can actually won't have to be removed from as a member of like a national organization as well. And so the first definition, I'm going to read verbatim, says advocacy aims to influence policy and practices in ways that benefits people's health and well-being in all societies in which they live. What's missing, I think, from this definition is a social justice component. So this is one definition that came out of Johns Hopkins, and I'll read some of the bullet points there. So because I think we take for granted, some of us that work for research, you're doing advocacy. But how can you get to that translation phase that Patrick mentioned? And we'll hear from our panelists what that looks like, right? So you're advocating technically, if you're encouraging positive change to the law, government, and service policies, improving access to scientific data and evidence, so what a lot of people here do, increasing financial support for interventions that improve health, and altering or shifting public attitudes and behaviors. And then the next definition, I really make you guys wait for these slides, don't have to suspense. And then with this definition set with a social justice foundation, I highlighted some of those words as well. So you're in pursuit of influencing advocates, but in this particular definition, just for you to draw on, is seeking to highlight critical issues that have been ignored and submerged, right? So we want to bring those to the front and enact and implement laws so that visions of what should be in a just and decent society become a reality. And finally, I just want to read this last sentence. Advocacy has powerful results to enable social justice advocates to gain access and voice in decision-making and participate in that process. And those really are the principles that undergird Checkup. We really have a co-developing of all of our programs. Something that I'm passionate about. The only reason I decided to do a PhD was because I knew I could do it in partnership with community. It was in for social services for older adults. I'm a gerontologist. And so I get really excited when research is going to do something to improve the lives of the person that I collaborate with. And so a few definitions just to set the stage for what we're talking about today. I have a few examples, but I'm going to leave it to our panelists to do this, but these slides will be available. And so you might even take for granted in the ways that you do participate. And then in other cases, I've talked to people that say, I do this research, I just don't know where to put my foot in. I don't know where I can connect with people that are doing work like mine. And so I just wanted to provide everyone a few examples of what that might look like so that you can get activated, or if you're agitated enough, to participate and contribute in a lot of different ways. That can happen in a lot of different ways. And then finally, I just want to make sure that everybody knows the Checkup website. We've done a lot of work to build this resource. These are collapsible menus. So you see the plus sign on the right side of the screen. It's a collapsible menu. And if you click on the bottom that says action and advocacy, there are some tools that Alex Sass and others at Checkup have done a lot of work to try and pull. We've done a scan of lots of different sites, teams across the nation, and pulled some of those resources together for everybody. And those links, I'm sure, are in our program, and you have QR codes on your table. And so I just wanted to point everybody to that. And then finally, another website we have at yours. Actually, Patrick and Winona, I interviewed for this project on what do policy influencers and decision makers need from researchers in communicating science. That was 2017. So you're all looking at me like, well, Kara, that was a long time ago. And I think even Senator Ching's office, I want to say somebody participated from your office in this. And so we learned some valuable insight about what researchers can do to more effectively communicate their research, specifically with the intent of it being used to make change. And so just a few resources for everybody that I wanted to share. And now I'm going fast.
It's my fault.
Oh, is it? Okay.
You're clicking, so I thought it wasn't working.
I'm gonna put the clicker now and say that you got it, Ryan. Thank you so much. Appreciate you. And so now I'm gonna turn it over to my co-moderator, Dr. Hillary Mersick, who's going to give a brief introduction to our panelists. All right.
You guys are talkbacks full over here, Carrie and Patrick. Hi everyone, I'm Hillary Marusak. I'm a neuroscientist at Wayne State University. I'm also a faculty member and one of the founders of Science Policy Network Detroit, which I'll introduce in a couple moments. But I want to very briefly introduce our rockstar panelists, and then we'll we have plenty of time to actually get to the good stuff. But their full bios, which were very hard to summarize, by the way, all of you, are listed on our complete program for tonight. So I'll start at the far left. Winona Bynum is the executive director of the Detroit Food Policy Council and Education Advocacy and policy organization led by Detroiters who are committed to creating sustainable local food system that promotes food security, food justice, and food sovereignty. She's also a registered dietitian and nutritionist in her spare time, I guess. She's also a warrior. She graduated from the coordinated program in dietetics, the Warriors. She also studied public health at Emory University. Next up, we have Katie Dwyer, who is another overachiever. She's a dual graduate student working towards her PhD in molecular biology and an MBA in finance at Wayne State. She's also, again, in her spare time, the president of Science Policy Network Detroit, which is a student-led organization at Wayne State University that aims to bridge the gap between scientists, lawmakers, and the lay public. And we're going to DC again next month to have our students talk to lawmakers directly. We were just in Lansing in March, I guess, this year, talking with Senator Chang's office and a variety of other offices. So students at work in the policy realm here. Then we were going to Senator Stephanie Chang, who is serving in Lansing as a state senator, also the first ever Asian American in the Michigan legislature. She worked as a community organizer in Detroit for nearly a decade before joining the legislature. She's a fierce advocate for all things science policy, issues related to opportunity, access, equity, and justice. Again, it's really hard to summarize this panel here. Matt Stifler is the director of the Center for Arab Narratives, a new national research institution through Access, the largest Arab American community nonprofit in the country. He was also Senator Chang's professor. So fun fact, he received his PhD in American culture from the University of Michigan in 2010, where he now serves as a lecturer in Arab and Muslim American Studies. He is also the research and content manager at the Arab American National Museum in Dearborn. And then last but not least, we have Jametta Lilly, who is CEO of Detroit Parent Network. She's a grandparent herself. She calls herself a parent empowerment advocate, a change agent, which I love. She's spent her life really dedicated to improving child and family services, child development, human development, public health. She's worked in all aspects, including the workforce. So very excited to have this panel. Can we give them a round of applause?
Thank you. Okay, so we have some prepared questions. We're going to start broadly so we can learn a little bit about all of your experience bridging the gap between science and society. And so in a few sentences, can you describe an experience you had using science or collaborating or drawing on research to influence change? And we would ask that of everybody just to give kind of a brief example if you have it. Should we go in some order? I don't know.
No one wants it, they passed the mic.
So one of the things I'm really pleased to share is amongst many blessings is having been appointed to Governor Whitmer's Racial Disparities Task Force during COVID. And if there's anything that we all know is pre-COVID and during COVID, we saw literally untold level of medical suspicion, falsities, and just totally bizarre dynamics that emerged from the highest office throughout all the communities that we were trying to serve. And so one of the things that happened very early, literally the second week, I remember it well, the week of March the 19th, about 30 organizations came together and said, the city is shutting down. How do we make a difference for our community? We love, we love our governor, we love our mayors, we love our county commissioners, but people are not watching them when they're doing the town hall. So we came together and decided that we would do a virtual town hall. I'd like to say that we literally broke the internet the first time we did it. They asked for a moderator. Nobody said anything, and I finally said, okay, I'll moderate. 3 years later, still doing it. But here's the point that was important. We all determined to focus in on first health, education, social justice, and basic needs. And we came as trusted messengers. So we brought in health folks. We brought in people from Wayne State University, U of M, Henry Ford. We brought in practitioners at federally qualified health clinics. We brought in moms, dads, uncles. So I just wanted to go is that what we did as community organizations, we leaned into the science and said that we're going to say science matters. And even in my own organization, I said, if you're not vaccinated, I love you, but you cannot work for Detroit Parent Network. So some of us had to then make those decisions as we led our own organization. So I just wanted to share that as an example of using science, even sometimes when it's not popular, but also to be inclusive and then helping break it down for people to better understand it, because there was a lot of myths to have to work through.
So I'm going to share an example that I'll probably come back to a few times this evening. So I work with the Arab and Middle Eastern North African, or MENA, community here in Southwest Detroit or Southeast Michigan and nationally. And one thing we know is we don't know much about the community because the data isn't there. The community has been sort of erased from data that gets produced by most federal, state, and local entities, because according to definitions of the federal government that go back many decades, anybody from the Middle East or North Africa or any Arab countries is considered white. And so it gets aggregated into the white racial box. And so we don't know, I can't even tell you how many Arab Americans there are in Michigan because we just don't have that data. And so for years, we've been working with the US Census, we've been working through the lack of data and working with the community and community leaders to address this, because we know we can't move forward on so many issues that affect the daily lives of our community without having some sort of basic shared data. And so, just advocating with the state of Michigan, Department of Health and Human Services, who have been extremely helpful. We now have some data on Arab and MENA communities in some very crucial health aspects. We've worked with Wayne County, we've worked with school districts, Wayne County schools, to make sure that the community has at least some way of identifying themselves outside of the white racial box if they choose to not identify as white, and that we have a way of counting that. And moving forward, we're getting very close to it being adopted at the federal level, and I can talk a little bit more about that, but that's something that's been ongoing for about 30 years here locally and nationally. So one thing I'll keep coming back to is it takes a long time to do this.
It's the long game.
Yeah.
Good evening. So this is exciting. Thanks for organizing this roundtable. In my former district, I had the honor of serving much of Southwest Detroit, and in particular, Delray and neighborhoods surrounding the footprint of the Gordie Howe International Bridge, which is being built as we speak. And one of the things that I am really proud of, just in terms of work when I was in the House, was a lot of the work alongside community members around the advocacy for community benefits, and in particular, health impact assessments and the voluntary relocation program, and many, many other things. So, but one of the things that, and that was, literally a 15-year and growing, at this point, probably more than 20 years of advocacy by community members. I think that one of the things that was really instrumental in being successful in our advocacy was data and science. So in particular, being able to point to the truck counts and some of the health surveys that the Southwest Detroit Community Benefits Coalition did leading up to the advocacy at city council level and with the state and with the Windsor Detroit Bridge Authority, to say, here's what the Community Benefits Coalition found, and actually going door to door, knocking on people's doors to find out what people's health conditions were, what they knew, what information they needed, all of this, and really gathering that data and being able to show here's what's going on in terms of people's asthma and COPD, and the fact that living close to the freeway, they can't literally the hearing loss, all of this kind of stuff, and being able to then use that data and advocate for, again, the home swap program, the health impact assessments, all of the historic community benefits agreements that were achieved at multiple points throughout the past 10 years. So So that was really exciting. I think one of the things that also was really, really helpful was being able to point to data around, for folks who live within a certain number of feet away from a heavily used roadway. This is how it impacts pregnant women. This is how it impacts people and their health outcomes, and being able to point to academic research that showed these things that was really, really helpful in being able to make the case. And also not just to the decision makers, but also to community members to say, these are the things that we need to think about. And obviously folks are experts in their own experience, and for folks who experience asthma and all of these things, that's very real. But being able to say, this is what it's connected to, and here's how this project that is about to start at the time is going to potentially have an impact on you, and here's how you can get involved and advocate. So that's one example that I love to share, because that was truly a grassroots effort that was over a decade in the making, in terms of just a lot of gathering of research and data at the grassroots level that led to over tens of millions of dollars in community benefits. So and I want to give a lot of credit to folks in Southwest Detroit who were involved in that for many years before I even contemplated running for office. So.
Should I try this? Yeah, so as Hillary mentioned, right now I'm the current president of a student organization known as CEC-PATH Detroit. And essentially we are a collective of student researchers around Wayne State's campus, as well as local other campus communities, and also faculty researchers at Wayne State. So I think, speaking from the perspective of a science research analyst or person, I think in terms of how we've kind of engaged or interacted with other researchers, is one example I can provide is that we've hosted panels in the past. So initially when we were bringing this group into fruition back in July 2020, that was, after COVID had already began. And so something that we really wanted to do, or something that we identified as researchers that was really relevant to our community as well as the surrounding communities, was the fact that there really wasn't a lot of trust in science, as some of these panelists have mentioned. And so we wanted to get out there and go into our communities. Oftentimes, I think it's important to recognize as scientists that we are kind of glued to our bench rather than interacting and engaging with our communities. So CEC-PATH Detroit really wanted to kind of flip the script and start going out into our local community, engaging with residents and asking them, what are some, issues that you see related to living in this city or living, around industrial areas in Detroit? And so we engaged with the community in that way and kind of got a lot of really relevant data from that experience. And what we did is then we brought it to a panel where I think it's really important as scientists to, not assume that we're the only experts in the room, that a lot of, the input that we get as well as the output that we give our members comes from community organizers as well as politicians, policymakers, decision makers. So the panels that we had hosted after gathering that feedback from our local community included researchers that were experts on the topics, lawmakers that, could be instrumental in the decision-making process. And then of course, I think what really was key was the community leaders that we were able to engage with that could really give us more of an understanding and perspective from our local community members. And so that was how us as scientists kind of engaged with not just other researchers, but also I think more importantly, policymakers and community leaders.
Okay, is this close enough? So the Detroit Food Policy Council, we're one of more than 300 food policy councils operating around the country. But what makes us different is that we came out of community action. So the Detroit Black Community Food Security Network and advocates and activists got together and said we needed a food policy council. Got the blessing from the city council, and here we are since 2009 and been working. But as such, our mandates and our marching orders comes from the community. One of the biggest issues in Detroit is access to food. We have grocery stores, but most are independently owned. And as such, the experience at those grocery stores are widely varied, right? Some do a really great job and some need a lot of improvement. So we formed the Detroit Grocery Coalition, and Wayne State University representatives have been members of that since 2016. So in addition to being part of the Cures Cab since 2015 and part of Checkup, Wayne State sits on our coalition that we co-convene. So they have helped us get the data because it takes data and stories. And usually community is rich on, we have anecdotes, we have stories, and that's part of what is needed to move the needle. But the other piece that's needed is the data. And so that's what they brought, the data. They brought best practices. We were able to exchange ideas. And we've gotten that work funded. And then even more so when the pandemic hit, they enabled us and helped us to make a case for food workers being looked at as essential workers so that they could get PPE. We helped the grocery stores get PPE so that they could operate safely, hand sanitizer, just all the things, the stickers on the floor. If you see some stickers on the floor still, those came from that project. And even early access to the vaccines as essential workers. But without that data, along with the stories, we wouldn't have been able to do it. So that has been one partnership, and you'll probably hear me talk more about that over the evening.
Thank you so much. That was an excellent way to kick off this panel. So as I mentioned very briefly, I'm a scientist. The onus is certainly on scientists. We don't always do a wonderful job of translating what we do, in the lab to the general public. And I think that's something that Wayne State is tackling, is equipping our young people to better, use less jargon and make it more accessible. But Senator Chang, I did want to pick on you first, because I know you have to leave a little early, but as a policymaker, what tools or strategies do you recommend that scientists or other people use to best advocate for policies?
So one of the things that I think is a really effective strategy is, okay, so there's policymakers who care about numbers and will follow a chart and understand statistics, and there's other folks who will really mostly listen to the human impact stories and be compelled to action based on that human impact. So I kind of think the most effective is to just combine the two and be able to present the numbers and the charts and the data and combine them with real human impact stories. So I guess I'll just share an example. This is an ongoing effort. It feels like it's, we have for many, many years been advocating around water affordability. This is the year where I'm hoping we're gonna get it done. At the state level, have been building towards, movement towards a statewide water affordability plan that also will allow for local water affordability plans and protections against shutoffs for critical care customers, et cetera. But I think in talking about water affordability, this issue has really grown and evolved since I've been in office, starting in 2015, where when we first started, there weren't really a ton of reports yet about this issue. It really was the human impact stories of folks saying, I had my water shut off, and this is how it impacted me, and this is how I ended up in the ER. With these types of health conditions and all of this stuff. And those human impact stories are really what brought me into being so passionate about this issue. But as we moved along, it felt like every year there was another report that came out that talked about, here's how being on this block where a water shut-off is happening impacts the whole rest of that block in terms of what types of waterborne illnesses are arising in that community. And then the next year, there will be another report that came out from a university around, here's how water affordability is becoming a bigger and bigger issue in Michigan and how water rates are becoming more and more unaffordable. And then the next year, there will be another report about how, this issue is impacting, X community. And so there just more and more data kept coming out. And then of course, the COVID pandemic, where, the number one thing before we knew about the impact of masks was wash your hands with soap and water. And so then, of course, that raised the issue, well, if you don't have water in your home, then how are you supposed to wash your hands with soap and water? So then that, I think, really raised this issue to an even higher level, where people were like, oh yes, we need access to water. And then we had federal money come down that then allowed our states to actually collect data from local water providers to say, how many people in your system are behind on water bills? It turned out the answer was hundreds of thousands of people across the state of Michigan. And so that then led us to be able to actually, in a Republican legislature, pass a temporary water shutoff moratorium, which people thought would be impossible, but we did get it done. So now, 8.5 years later, we're at the point where there has been so much growth on this issue, in part because of people telling their stories of having their water shut off, and also all of these reports where we can now show, here's the impact on people's health, here's the numbers, here's how water rates have been going up, here's how they're projected to continue going up unless we do something about it. So just that combination of both the stories and the data, I think, has really led us to the point now, and of course the change in the makeup of the legislature has led us to the point where we, I think, will finally have the opportunity to get something done this year. So it's exciting. So in terms of a strategy, pairing data with stories and continuing to build that momentum. Hopefully issues don't all take 8.5 years or more to get done, but sometimes, unfortunately, it does take that amount of time to build that kind of consensus. So.
Thank you so much. And as Jametta said, it is the long game, so we'll keep repeating that. I did want to mention there will be plenty of opportunity for questions at the end from the audience, so please hold on to those, as well as folks online. We will have a moderator. So this next question is for Matt. As someone who is uniquely embedded in both academic and community organization spaces, you're really in a unique position to comment on how to best communicate sometimes complex scientific information to the general public. So what would you recommend for that?
Yes, thank you. I think about messaging a lot. I'm not an expert in marketing or messaging, but my organization, our goal is to take research that's being done on the Arab and Middle Eastern community and take it out of the walls of academia and put it into plain language and get it out there. Because that research can't happen without the community anyway. They're the ones answering the surveys and going to the focus groups and having their blood tested or what have you, but it never gets communicated back to them. And then we'd also like to facilitate research, which is our researchers come to us and say, hey, we need 100 Iraqi immigrant women to fill out the survey. And then we help find those people and formulate that research. So in both cases, we're doing a lot of sending messages out to the community and helping people respond. And we do a lot of that through online messaging, Instagram, emails, Facebook, what have you, which is what I think how most of us get our information. And so one thing that I think that researchers and scientists can benefit from is slowing down a lot. One thing I see is they'll say, hey, can you send this flyer out to people? And the flyer will have 600 words on it and all these asterisks and all this. And I'm like, nobody's gonna read this. They're gonna see this, they're never gonna read it. And even if they're interested in the subject matter, they're not gonna sit and read. Who wants to read? I don't read that much. If somebody sends me an email that long, I'm not reading it. So they think, a scientist is very interested in the research, they're very excited about it, and they want to grab you and just tell you everything about it all at once, because they think, I only have your attention for 10 seconds, I have to tell you everything about this topic. And that's not how most people want to receive information. Most people want to see something that piques their interest, and then they'll follow up on it if they're interested. Which brings me to the other point is, sometimes people just aren't interested in what you have to say. And sometimes people, researchers will come to us and say, hey, can you get your community to fill out this survey? And we'll try everything and nobody fills it out. And they're like, well, clearly you're not doing something right. Try this, try this. And I'm like, people just don't want to do it. There's some things you just can't message to people because they're not interested in it. Now, you can get people interested in it, but that takes a lot of work. Slowly over years, having forums, having, giving out free food and talking about things and meetings, such as this. So building interest is big, but even when people are interested, just very slowly roll out information. Few words, something like interested in improving your health, click here, instead of, basically a summary of a 25-page academic paper that no one's gonna click on. So yeah, I really think like, don't explain the project how you're thinking about it. Really work with people to explain the project and how most people would want to hear it. So, yeah.
Oh, that's great. I think researchers, like myself, are not trained in marketing as well, so that's a great lesson. This next question is for Winona, all the way at the end. So as you mentioned, we know you're doing really important social justice work related to food access in the city of Detroit. So in your view, we'd like to hear what are effective processes for sharing, identifying shared goals between community members or other stakeholders and researchers.
One of the things, and I'll pick up on what Matt has said it takes a long time, so building relationships. So that's so important. To have a real interchange, you have to have that relationship. When I talked about the work that we did over during COVID, the COVID pandemic, that relationship was already there. So with folks who work in nonprofits, and I worked corporate and nonprofit, I could not have imagined how much time I would not have and how busy and how many hats I would wear. So you're running crazy. So building that relationship and seeing over time that there's a benefit to this, that this is moving your work forward and taking a real interest in the work is so important. And the other thing is approaching it with humility and curiosity. So like I said, researchers they have a lot of data, and then we have the lived experience and what's going on in the community. And when those interchange, it makes it even better. So like I said, the best practices and to tell me what's going on in another community and to give me the data to validate or either say, well, maybe that's not what you're experiencing it, but it may be coming from somewhere else. But that interchange makes such a big difference. I'll just tell a really quick story. So many times people are focused on with food. How many apples does a person have? How much does it cost? That's important. But the other part that anybody who's a Detroiter knows is also the experience that I get when I go into that grocery store, right? Is how I'm treated. Am I greeted respectfully? Do you have amenities? Can I use your restroom? All of those things make a difference. And what we found was the customer service piece was so important. So when we told the researchers at Wayne State that, they were able to help us come up with some evaluation methods to be able to track that. But that wasn't what they were focused on. They were focused on what everybody else was focused on. And in turn, like I said, it helped us get support for those programs because we were just out telling the stories and that didn't mean anything to anybody who had any funding. Like, I wasn't treated well, okay? But when I can put some data and show what is actually happening, then things move forward. Slowly, albeit, but still they move forward. And so I think those are the biggest things, just that relationship building, knowing that it takes time, and approaching the relationship with respect, realizing that there is real value in what's in the community, and it should be respected. And then we can realize that, researchers bring a tool that's very valuable, because for me to do evaluation is something that I might not be able to stop and do, but for someone to do it and do it well is just invaluable, so.
Thank you so much. Let's go to Katie now, just to keep it simple. How can students and young people get involved in science advocacy and policy?
So I think there's a lot of different ways you can get involved. I can say for me, for instance, following the COVID-19 pandemic, and seeing all the distrust with scientists and everything, it kind of got me a little bit motivated and more interested in science advocacy. And from there, I had just done a little bit of Google searching and just looking up like, science advocacy or science policy groups around my area. And I came across MSU's group that had already been established for a few years. And I reached out to them and they were like, hey, Wayne State, you have your own chapter that's about to start. So that's a little story about how I got involved with CEC-PATH Detroit. But specifically for students or young people in general, I think, like I said, there's a lot of different channels you could use. I think for me, the ones maybe I'm most familiar with are different professional organizations. So for example, in like the academic space, there's organizations such as AAAS, which is the American Association for the Advancement of Science, I believe, and a whole bunch of different organizations with a whole bunch of different acronyms that you could join as a young person or someone that's, really passionate about science and passionate about making a difference within your community. Outside of those more professional organizations, which most of them are national. So, you can join from anywhere that you're located and really still focus on your local community. But outside of those organizations, I think there's also paths, within your institutions that you work with. I'm familiar with a lot of institutions in the healthcare industry that have their own like science policy analysts. So you can get involved at that step. You could also work under people such as policymakers, community leaders to kind of get involved with their organizations or what they're doing to advance, certain science policy or policy related things. And outside of, the community groups and things like that, again, I think really even just starting on your own could be a great first step. I think it's really useful to kind of collaborate with other organizations that have similar interests that align with your own, but yeah, I think it's really important for scientists to get involved, and I'd love to see more young people getting involved, but those are some of the avenues that I'm aware of.
Thank you, Katie. This is an excellent panel bringing in really all perspectives. Let's go to Jametta now, so all the way at this end, to get a different perspective. So as CEO of Detroit Parent Network, how does your organization use scientific information in your decision-making, and how can this be made more accessible?
Sure, thank you. So DPN has been around about 20 years, so I'm really proud of that. And it's always been about educating, equipping, and empowering parents to be champions. But I'd like to add in the 5 years that I've been able to be here is talk about be champions for change. And I want to just kind of hit that for just a moment, because I think that we also have to recognize when we talk about science, and we talk about things like medical mistrust, et cetera, it's really important for us to recognize there are real reasons why there should be mistrust. And we need to understand the historical nature of science as it has been perpetrated, particularly on people of color, on women. And when we don't have those kind of honest conversations to enable us to come up with research questions that in themselves are not biased, because there's huge biases in the very nature, particularly in social science, about what we say that we're going to study. And then we're surprised at the result when many of us go, no, it goes back to what was your premises, what were your assumptions. So I want to say that to say that the opportunity that I find really exciting is the work that Dr. Haley Thompson has done and many others at Wayne State, U of M and others, who are looking at science as a tool, not only in terms of having the appropriate empirical this, that, and other that's required, but really see themselves as people that to engage in change of what was, to use science to improve what can be. So out of that perspective, one of the things that's been interesting, I like to talk about the intersection between health and educational outcomes, because it's the same thing. The poor outcomes we see for our kids in school are reflected in also our health outcomes. So one of the projects that we've done is we like to work with scientists and policymakers and we have all this great work, and then we'll say, okay, now our parents are going to break it down and you can put it on your website to look like this. So one of the things we did is some community familiar with called Education Trust Midwest. They do a lot of important work around educational equity and funding, and are wonderful, and they will tell you we're policy wonks, and you're wonderful. So when the third grade reading law came out, we all knew it was draconian when it first came out. We also knew that there were factors that were impacting children's reading proficiency that tied back to, ta-da, health. So we know asthma is the number one reason for school absenteeism. We know that children that come from environmental sections who are exposed to the same toxins you're talking about do poor. Who was bundling that data to say, well, wait a minute, do we see higher levels of children with poor reading proficiency based upon different health outcomes? You know, I was saying it, I was looking to who's the scientist who can get back up my hypothesis, not us. I don't need it in all cases. I just say, this is really what it is. We know it is. But the other thing that we did that emerged in working with Ed Trust is not only did we help to change the language that was being used to talk about the importance of the law so that parents can read it. We actually had a team called the 3G team. So our parents were the ones who did 3G workshops all across the city using that research. But we also leaned into our local health department, Denise Fair, even Jonay, Caldoon, when she was there, to use the data to talk about the other health factors. So when we met with families, we didn't talk about just education. And we didn't talk about just health. We talked about that intersection and how parents can then be advocates to understand not only what they need to do in their home, but also to mount up and be ready to be a voice for the change that's necessary. So I just wanted to use that as an example of some work that we were doing and we're in fact continue to do. And I'd like to invite those that are here. Next week, the Michigan Civil Rights Commission is having their second summit, a statewide conference. And in that summit, we're talking about the importance of health and health messaging. And also we're talking about how health and education to move us forward. And we need to have a science that really shows this a lot more. I would love to be able to see that.
Amazing, thank you so much. We'll go back to Senator Chang. How can community groups, researchers, and also lawmakers better work together to identify and accomplish shared goals?
Yeah, so one pretty current example, fairly current anyway, is the work that we're doing around gun violence prevention. So earlier this year, the Michigan legislature passed bills related to extreme protection orders, universal background checks, and safe storage, otherwise known as child access prevention laws. And one of the pieces that came in through the committee process as we were, hearing testimony on these bills was the Institute for Firearm Injury Prevention at Michigan said, oh, we want to be able to collect data on, how this gets implemented. And we hadn't thought of this, but it was a really good idea. So, so we did actually build into which bill? I think the Extreme Risk Protection Order bill language that basically allows for data sharing from the State Court Administrative Office to educational institutions for the purpose of, de-identified data to be able to track, basically what's happening with these extreme risk protection orders as we start to implement this law. And one of the things that I'm currently working on is bills that we've introduced several times before, but this term will get done around domestic violence and prohibiting those who have been convicted of misdemeanor domestic violence from having, possessing, transporting, etc., a gun for a period of years after they are back in the community. And again, we realized, oh, we actually should collect data on this as well. And so, in terms of building shared goals, that was the question. As a lawmaker, of course, I want to be able to, my goal is, we've got to pass this bill, but also we need to make sure that it stays in law. From the university's perspective, they want to be able to engage in this research. And then from the community, every town wants to make action to all these gun violence prevention groups and folks in the community who are advocating for this. Well, of course, they want to be able to just see the impact of this. So it's in all of our best interest to be able to collect this data so we can continue to say this law is needed once we get it passed. We all have this shared goal. We'll come from it in a little bit different angle, but I'm hopeful that we will be able to get it done and include that data piece, because I think, we've got to be able to, as we're implementing all of these historic laws that we're passing over the past 6 months, we've got to be able to say, you know, this is working. So that data piece, I think, is really, really important. And but sometimes as lawmakers, we're not always thinking about that. So it was really helpful when the university reached out to say, can we be part of this bill? Can you make sure the data is collected? One other thing that I just really wanted to briefly mention is one of the things that I really love that's happening a lot more lately is this idea of citizen science. And so, you know, in my district, in different parts of my district, there are all these groups that have their own air monitors, these handheld air monitors to be able to track what's happening in their neighborhood. And so I just remember when in Trenton, in my old district, when they were demolishing the old McLeod steel plant, I had a resident reach out who lived in Riverview, just like literally right outside of Trenton, that was being impacted and was wondering what was going on, what was in the air. And so I connected that person with a professor who had air monitors. And so that professor was, sure, we'll give you some air monitors. So in terms of, you know, how do we build these shared goals? Sometimes it's honestly just bridging, like building those relationships and being able to help connect people. Because a lot of times, you know, people might not know what resources are available. I don't know if you know, the person who reached out to me even knew that there were such things as these handheld air monitors, but being able to just literally reach out and say, hey, this is what's going on. And then me being able to help make that connection. We've got to just keep doing more of that and building those connections, building those relationships so that people even know what resources are out there and what questions people have in the community so that, you know, we can provide those tools to help get those answers.
Thank you so much. Relationship building is another key point from taking from this. Let's go to Winona at the end. Based on your experience, what do you suggest other community organizations do to participate in conversations regarding research and advocacy? How do they get started potentially?
So participate, look for ways to participate. Look for people who, other organizations who are working on what you're working on. In my case, in the Detroit Food Policy Council's case, we were invited to the table and we accepted the invitation, and it's been great because you get to influence research, you get to meet others and make other connections because silos can really stop the progress of work. It's important to work deeply, but then it's also important to have connections and to see where your work connects to another's. So basically just look for those opportunities, take those opportunities, reach out to Wayne State, reach out to folks doing work that interests you and let them know that you're working on it. And then for researchers to make sure you get in the community and build those relationships and look for people who are doing the work that connects with your research.
Thank you so much. You can give it to Katie. We'll keep it simple. So Katie, in your view, what can student scientists, even bigger institutions like Wayne State or other universities do to better bridge the gap between the science, the lawmakers, and the lay public?
Yes, I think that's a great question, and I'll address a few of them. So in terms of, you know, what institutions can do to better address like science policy, getting their own scientists or students involved, I think, you know, from the perspective of Wayne State University or other science policy groups that we've worked with that are affiliated with different universities around Michigan, I think it'd be really important, and you know, Wayne State already does quite a good job at this, but I think it's really important to make sure that you're really highlighting the work that these groups are doing. Not even necessarily for like the accolades of highlighting them, but rather to get their name out there. So, you know, our group within a matter of only a few years has grown pretty large. And I think that's, you know, in large part just Wayne State being willing to work with us to kind of highlight our group's efforts, to introduce us to other community members when we were first trying to get our foot in the door. So really trying to navigate the science policy space. I think, you know, universities can kind of step in and make sure that they're helping us by providing different sorts of resources. I will say one of the best resources we've had is our government and community affairs staff at Wayne State University. You heard Patrick Lindsay in the beginning, he's one of the best. So again, just making sure that universities are providing those resources for their organizations that are centered around science policy work. But in terms of funding agencies, this is actually a conversation I was having with one of the audience members before we started this panel, and something that I think funding agencies might kind of benefit from, or different types of professional organizations, is making sure or allowing organizations to team up with community members, community activists, things like that, to submit applications or proposals for funding. So some of the experiences I've had so far within my group is seeing that, we have certain funding opportunities because we're affiliated with an academic institution that maybe community partners might not have access to. And so I think it's really important for, institutions like that to make sure that they're offering funding in collaboration with other community groups. Like everyone has kind of echoed on this panel, it's really not just, the data, it's the stories behind the data. That really make that full picture and kind of make the work that we do push forward and progress. So yeah, I think making sure that institutions are providing resources and also allowing those resources to be shared across groups that are all focused on one or a particular set of topics is really important.
Awesome. And just to echo that really briefly, I think universities, the whole system is not built for this kind of work. And I know Carrie does a lot of this too. It's not recognized. Professors were rewarded for writing papers, writing grants, for crunching data. We're not rewarded for going into the community and doing this kind of important work. So I think that's a much bigger issue that we just need to continue to highlight. Let's go to Matt. How can researchers and community stakeholders better work together to find these shared goals?
Thank you. And you just highlighted one of the barriers is that universities are not spaces where things happen quickly and efficiently and people get rewarded for the kind of work that should be done. So I think my advice to build partnerships that actually get things done that aid the community, which should always be the goal. If your goal isn't to actually benefit the people that you're doing the research with, you shouldn't even be doing the research. Go study something else. Because I see this too often. People will come to us. They've been sitting in their office maybe for a year. They came up with a research idea that they thought was really cool. They draft the survey, they get it approved by their university's review board. They get the funding, they get the grants, and then they come to us. They say, we've got this study, you want to help us with it? Here's the survey. Please distribute this to your community. And then we read the survey and we say, we are not distributing this to our community. First of all, it's not translated into Arabic, so half the people aren't going to be able to read it. Second of all, you ask questions on here that our community would not be comfortable answering. And third, we don't think you even know who the community is. You haven't done the research, you're not coming to the events. I've never seen you before. You've never come to one of our events. We don't know who you are. And so there's this assumption that I'm doing research that's going to be good for all of you. Why aren't you taking part in it? And we have to navigate through that a lot, unfortunately. The way that it's happened very well is somebody comes to us and says, I think I have an idea, but first I want to meet with a bunch of people and see how I can be of help. I have skills. I know how to find grants. I know how to crunch numbers, or I know how to do A, B, and C. And let's meet with some people and see what I can help. Is it a neighborhood issue? Is it, like Senator Chang is saying, is it air quality? Can we give people monitors? Those partnerships work out very well. And also the community is compensated because they're written into the grant. So the citizens scholars she was talking about, like people get paid to be on the research team. They get paid to translate, they get paid to hand out surveys. And that's when it works well because everybody's benefiting at that point. But that takes so much more time. And that's not what the universities are looking for. Sometimes that takes 2 years from idea till you even get to work. Sometimes more. And that's just how it's going to have to be if you want it to be mutually beneficial for everybody. And so it doesn't always happen that way, but when it does happen that way, the results are much better for everyone.
And I was gonna say, Carrie should jump in here.
Boy.
We're not done yet.
I also just want to say, people that do work that engages communities, there's a lot of people that I talk to that might have questions that don't actually match my skills. And so I see myself as a conduit between a problem and a solution. Maybe Hillary studies that, maybe Haley does. I've tapped a lot of different people to say, I've been asked this question and I study late old age, and I can tell you as someone that studies people that are 75 and older, I participated in a research project on maternal health outcomes, and I did a terrible job. It was a completely new experience. I felt so out of my element, but did my best, to use the tools that I have to work with those individuals that invited me into that project. But we don't have, there's no silver bullet approach. So even if you have the relationship, if you're leading with listening, we hope that researchers will say, well, I can't help address that issue, but I want to be a conduit for others who can have a mutually beneficial experience. For example, I've known Winona since 2014, 9 years we worked together, and our work has never intersected. But the conversations that we have and when I participated or came to check up and Haley invited me to this, I said, Winona, this is a really great match for you to serve as a steering committee. And so while some of the work that we've, come together around in other situations, things also evolve over time. And so some of my partners have also influenced me as a researcher. I didn't study digital connection in Detroit. That's where I am because people are saying that this is a problem. And so this is a new area of research for me. And so it also helps the researchers evolve, but also bring in other people that they know across the academic community to kind of help build those, synergies and find those intersections. And so researchers want to be a resource also for connecting others. I can't solve very many problems, but hopefully can be a bridge between people that are better matched to work towards a shared goal. So just could not say that.
No, yeah, I think Carrie talks a lot about community-based participatory research. So this is a totally different framework that Matt described as well. And I think my take-home message is just be patient with scientists, because a lot of us did get into this to really help people, either science or medicine. We're growing up in an environment where this is how we're taught to do things, but I think it's going to take a long time for that to shift. So I think the reframe of using science as a tool, even for students or young citizen scientists, I love that example of teaching our young people to be their own scientists and using that tool to put data behind what they're experiencing in their own lives. I think that's really the future, but this is really the long game, which is another story. So thank you so much for bringing that up. I have one final question, and that is for Jametta. We'd love to hear an example from you from Detroit Parent Network about an issue or challenge that your group worked to resolve by collaborating with other groups, policymakers, or even researchers.
Thank you. So one is a little bit of a stretch, but it's always good for us to do a little stretching. And I love what we were just talking about with advocacy. I just want to pause for a moment. I think we should breathe and recognize that we are in a place surrounded by advocacy. The people that we see on the wall understood. What we are the beneficiaries of are the people who understood advocacy, the stretch, the energy to do that. So I think it's always important that we recognize that we stand on the shoulders of others that give us opportunities that we have to even talk about this. And so policy, we think, is really important. And so often when we talk to parents, we talk to them about the important things like brain development. So what are those wonderful things that are happening in those first 3 years of life? And yet I think as we talk about trying to break science down for parents in nurturing their children, nurturing relationships, nurturing themselves as human beings, we also have to figure out how we make policy not that strange thing that those people do up there. So we try to do things at the grassroots level and also then at the grass top level. So an example is that we have a group of parents we call our Powerful Parents for Change. And we've been engaged with them of looking at health equity as well as educational equity policies. And we've worked with them to dig down into, well, what are the policies when we talk about addressing Black maternal morbidity? Oh, it turns out that who knew that midwives, the science shows, including you, that midwives are the primary factor that makes such a profound difference in the birth outcomes for both the child as well as the woman. Well, how many of us know that? So, okay, so if that's a fact we know from research, then how do we go from advocating about that for not only your pregnancy, but how do we begin to take that to legislators and to take that to the other folks who are so important, the health plans? So as an example, we've been engaged with them in this kind of journey of identifying, what do you think are things that are important? I think mental health is important. What about mental health? So do we know that school-based health clinics happen? So we dig down, help parents begin to identify what are some measurable things that they can begin to advocate. And then we said, you know what? We're going to take it to the people who matter. So for the second time, we did our Parents on Policy town hall for Mackinac Policy Conference. Because I can guarantee you, parents have never presented at Mackinac Policy Conference. So 3 years ago, my board chair and I called for that. But so we've been doing what we consider to be the second best thing, which is bringing their voice. We brought in families from Flint, from Detroit, and Grand Rapids to make specific recommendations and engage with people like Anjali Powers, the CEO of Skillman, like Senator Santana, and others to have a discussion about here are the policies that we've been looking at and that we want to advocate for. So that's an example of using science to begin to think about then what is the program level change that we can advocate for, what's the system level change that we need to advocate for, and then help them understand that, guess what, we don't have 1,000 Stephanie Chains to represent us, but we do have a lieutenant governor, we do have a governor that you can interface with, and they did, and they're getting their voices heard. But we can only do that when we have research that is completely competent, when we have researchers who understand and have been doing something that I certainly grew up with my dad believed in as a sociologist, participatory observation, that the way you get to know folks is that you go where the folks are. And so by doing that, that we've been doing that same thing, is empowering them to understand science, to get to best practices, to take that up to policy, and then help them feel powerful that they in fact are talking to a policymaker. And as we know, each one of those drops in that ocean, that when they come from multiple people, create the waves of change that we need to see. So, you know, that would be an example that I'd like to share. And hopefully next year, we'll be able to tell you that we actually have a panel of parents presenting at that policy conference that represents the diversity of the state, and the diversity of the voices of the parents that are about nurturing your children and creating change.
We just give a round of applause. Okay, so Hillary and I had lots of questions, and so now we're going to, I'm not online checking my bank, I'm actually online at this event and looking at the chat for audience questions. And so I just want to note to Alex and Naya, I can only see the chat box up till the point that I logged in a few minutes ago. So I'll see new questions, but also you all who are here in person are welcome to ask questions, and we have a microphone we can bring to you. So we have one, Rick, but I'm going to start online. And this question is from Marwa, and the question for the panel is, how would you propose we empower our students to be involved in policy advocacy for MENA identity? It sounds like this is a good one for Matt. So how would you propose we empower our students to be involved in policy advocacy for MENA identity? Also, what resources can we provide them in learning about the struggles and history of this population?
Thank you, Lola. I can be brief. I think the easiest way is to have the students ask their university why they don't collect data on the Arab and MENA population, because chances are they don't. There's like a handful of universities in the whole country that even do it. So first start with that conversation, you know, go to admissions, go to whoever the IT people and say, how come you can't just add a box on when people enroll in the school, it's just adding a box for more ways for people to identify. How hard can that be? It's very hard apparently because it doesn't happen very often. But that's one way that students can get involved in. I've seen this happen at many universities. So there's a lot of examples I'd be happy to share. You know, resources, there's a lot of resources about the issue. It's been a big issue for the last few years. And I would say you could go to my organization's Instagram feed at Arab Narratives on Instagram. And, you know, a lot of different places you can go. We work with a lot of different partners around the idea of MENA identity, which isn't just about collecting better information on the Middle East and North African community. It's about collecting better information on everybody. And that's what we always advocate is we're saying right now, add a MENA box, but by doing that, you actually get better data on all communities. So making sure we're not only advocating for ourselves in isolation, because that doesn't really help a lot of people.
Thanks so much, Matt. Rick, I think we have a microphone that Zach has. Where's Zach? Zach is a, hello, Zach. That's Rick, and he has a question. Yeah.
Okay. I can run it over.
Oh, here.
Oh, wait, they need the mic. Oh, sorry.
I'll bring it back if I need to. Okay.
Zach's here.
Thanks very much. This was very exciting to me in lots of ways. A very quick introduction, and then I'll make a comment. Rick Zimmerman, trained as a medical sociologist, but I've been doing work in HIV and teen pregnancy prevention, lots of need for advocacy in those areas. And my work has also overlapped with health communication. And so it turns out that there's actually research on the most successful way to take research and convince policy makers about the research. And it suggests, by the way, on average, the stories work better than the data. But I would love for this group and you all and colleagues to get together to talk more about this. Let's do some research on that. You guys that have both great data and stories about how you've tried to use data and stories. Let's see if we can help the whole, community engaged research community, researchers and community members get better data on what is most effective ways. What are the most effective ways to take scientific information to help convince maybe different kinds of policy makers and leaders? Maybe there are different ways of presenting to different folks, and that would be a great, bigger conversation to have, and I'd love to participate in that. So thank you all so much for the really important stuff that you do.
Thanks so much, Rick.
Sure.
And that is I think Katie mentioned it, the science of science communication is a really important and growing area. And AAAS is a great resource for that. The American, well, I'll have that in a minute. Thanks, Rick. I love how you connect those dots for all of us that we're doing. We have all these skills and that we could bring together to actually make impact faster, right? Because the time moves very slow. So one more question. From your experiences for how much do intersectional identities play a role in the proposed policies and the success of these policies? Let me repeat that. From your experience, how much do intersectional identities play a role in the proposed policies and the success of these policies? Arlen, do you want to elaborate on that question a little bit?
Hello, do you hear me? Hello, do you hear me?
I give her a minute. Go ahead.
So I really don't know if this is what the person was getting at, but one thing I will say is that identities and lived experience matter. So of course, we're an advocacy organization. And so when we meet with lawmakers, so one of the things that we do is actually work on federal, state, and local policies or laws that impact Detroiters. So I've had the opportunity to even work on a farm bill and go to talk to our senators and our congresspeople. And one of the comments I got is that I was with a group that was diverse in every way you can think of: age, gender, sex, race, everything you can think of. And they were saying that if the folks that they talk to regularly looked more like our group, our policies would be different. So it really does matter, your lived experience, being able to point out blind spots. A lot of times lawmakers, a lot of them have good intentions, but they don't have the lived experience, so they don't know that, what they're proposing won't work on the ground. But if folks who actually have that lived experience and who are using the programs that they're designing get to include their voice, it makes a big difference in how that outcome looks. And it's easier to shape a policy before the law is passed than after. So I'm always encouraging people, when something is up and people are writing it, be at the table. I always think about Shirley Chisholm, if they don't give you a chair, bring your own. Sit at the table, get there, and make sure your voice is heard.
Thanks so much for anybody else? Okay. Does anybody here have a question before I move to our next online question? No, yes?
Oh, this question is for Katie.
I'm gonna repeat that question so the online audience can hear it after you state it.
Oh,
Go ahead, yeah.
I didn't catch the name of your organization.
SciPol Detroit, or Science Policy Network Detroit.
We've got business cards, I'll run them over.
Absolutely. Thanks. The question was, what is SciPol Network, Science Policy Network? So,
And just a statement, it's really good to be here tonight, and I work with community groups, and we know that we lack the data. We don't have the data to help us with some of our issues. For instance, we know that a particular, thank you, we know that a particular manufacturer, is polluting. And because all the neighbors say, they have trouble breathing. But, I didn't know about like the handheld air monitors, and also like having a connection with like students at the university who could possibly help us in trying to get some of the, how we, help us organize how we collect the data, that kind of thing. So this has been very, very helpful to me. Thank you.
yeah, Katie has her mic. If you pass it to Janetta.
I just wanted to echo something about how important students are. The experiences that we give our young people, even from what we have something called the Young Inventors, which is 4 and 5-year-olds that we let them dress up in lab suits, because they're going to be our future doctors and scientists, and also so we should start there. But I also want to encourage that more of our universities have really delivered in working with community-based organizations. One of the things that I've done, no matter where I've been, whether it's Head Start programs, when I worked in the health department, mental health, is always saying to universities, give us interns. So right now I have 4 for my 5th time that are part of University of Michigan as a future public health leaders program. And in other times, always welcoming undergrad and graduate students, don't come and do like 1 week. No, hang out with us for at least 8 weeks so that you can begin to get exposed to different values, different kinds of expectations, a different world lens. And that's why it's also so important that we're also talking about the range of ethnic specific organizations, because we live in a changing society and we're monolithic in too many different ways. But again, if we can make sure that there are more placements of students and organizations. And so I will say unequivocally to any institution that, we're here for this. And one of the things I would share, that not only are students so important for where we're going to go, but let's make sure that we start with students as early as junior high. So we're encouraging people like at Wayne State University, the medical school, who are doing programming in junior high. I look at our friends in the back, SimHop, as we talk to organizations and communities. So how might we all get more focused on, one, our young people, exposing them to science, exposing them to the medical field, even though that may not be their direction. But we're giving them the exposure, we're enriching their lives, ability to analyze and think, because we need those skills moving forward. And yes, let's make sure that we open the doors for community-based organizations and institutions of higher learning to work together.
I just want to echo, thank you for bringing that up. First of all, I didn't get your name.
Oh, Gracie.
Gracie, we should talk after. I work in an environmental health organization at Wayne State University, and so I'd love to talk to you after, so the whole room and everybody online doesn't have to hear. But I'd love to connect and hear more about your concern. And then back to what Jametta said, we also can connect you with resources related to BPH and MPH students. Both do a practicum service learning component at Wayne State University. Some of those students work for me, and I know I connect them with organizations that I'm familiar with, but if we can bridge any of those gaps for any organizations that might be present, I'd be happy to do that. It's not only a real hands-on, it's different to learn, but to actually like get your, get in there and see the work and the experience in the environment, such a incredible learning experience to be in the organization, boots on the ground. So thanks for that. And now we have one more question. And before I pose that question, I'm gonna get in trouble if I don't do this. So I just want to start people thinking about filling out an evaluation. What's happening is we have to build interest in our programs, and we actually decide to shape the programs based on what we're hearing from everybody. So if you want to have a program on communicating science or advocacy or whatever it is that your needs are that we can help fill, please not only give us feedback about what we're doing here today, but if you're inspired about what your needs are, there should be a printed version in front of you on your table, and Alex can show that if there's any confusion. And then online, hello you all, there should be a link in the chat. Alex and I are saying that is true. And so you should be able to click on that link. And even if you don't fill it out now, if you do it later, Alex is also going to email you tomorrow to nudge you again, maybe the day after that, the day after that. So save yourself the pain and just start filling that out. We would really appreciate it. We really do use that information to shape what we do. We don't just make this stuff up in a group. Lisa Braddix, who is our part of our internal team from SEMHA, helped shape these events, and we use also her input, our steering committee input, and then the input we get from these evaluations. So they really are very important. So thank you so much. My word is down there. Okay.
Data matter, right? We just talked about this.
Data matters, right? That's what we're here today doing. Okay, so final question for our panel. As a faculty member new to the Detroit area in Michigan, interested in studying, sounds like Matt is a very popular student. That question is going to be focused around you. And interested in studying the formation of STEM identities for MENA students, so MENA, Middle Eastern North African students. What resources can Access provide, and how involved does the center prefer to be involved with projects like that?
So MENA students who are interested in STEM, is that the question?
I think so, yes.
Yeah, there's a few things out there. I mean, nothing's really formalized, but there's a couple of funds that are available for students interested in STEM in the MENA community. If you go to the Center for Arab American Philanthropy, they have some scholarships and things and programs for folks interested in STEM. There's not a lot of, I can't point to any study or any research because like I said, we don't have a lot of data on the community. And that's one of the places that it is lacking, but I'd be happy if they want to follow up with me personally, happy to speak with them after the event sometime.
Great. So Hiba, we will be connecting you with Matt,
Yes.
and anybody else. She said, okay, thank you so much. So, yeah. Okay, any other questions that I've missed? Anybody? I'm sorry, one more time.
There was one for Janetta from East Girl.
I'm so sorry, here it is. Yes. Okay, question for Jametta Lilly. I'm a Wayne State MPH student working on a project for a policy advocacy toolkit for birthing centers in Detroit. What are some community organizations I should engage with? Someone Janetta would definitely know this.
Okay, there's a list. So one, reach out to the Detroit Health Department, the Sister Friends Program, Shirley Grant. Also the Detroit Earth Center, that's Leslie Welch. Henry Ford has a wonderful community health worker program, When Women in Neighborhood Networks. There's actually, if she does a Google search of MIHP's maternal infant health programs, there'll be a number that come up. The other around advocacy is Mothering Justice. That's all about making sure that Black mamas have what they need to be healthy as well as their babies. And Quietus is kept, so all of those are just a couple. There's Family Partnership, there are a number, and almost every single federally qualified health clinic, whether it's Chaz, whether it's, Detroit Community Connections, all of them have maternal health programs that could use that kind of support. And Detroit Parent Network can use that support, because we work across, we're multi-generational. And while we're not trying to talk to hundreds, our work is in authentic small groups. So we work with women who work with their girlfriends, and we also work with we're really proud of the work we're doing with Well Woman Wednesday, with Dr. Hassan and her team, with Make Your Date. And what we've been doing there is to make sure, how are we connecting the science of what's been going on outside of the perinatal research branch, infant mortality reduction, and then how do we move that forward into the community to provide service. So there are actually a lot of folks who would love to be able to get anyone who's willing to help bring some of those kind of tools to the table.
Great. Okay.
I have 5 more, but you can contact me.
So if you have more questions, you didn't get all that, great list. Jametta is an incredible resource. She said, thank you so much, Jametta, so thanks for that. And if you want us to connect you again, we can do that. Questions from our in-person audience? I see none. So I just wanted to, I was furiously taking notes to just kind of help bring all of this together. Where do we go from here? We don't really just want to have this conversation and go okay, well, yeah, it's a wrap, we're done here. We'll build on what we've learned here to help continue to put on programs like this through Checkup. What is Checkup, right? The Center for Health, Equity, and Community Knowledge in Urban Populations. The goal really is to upskill researchers so that, and connect them with resources and organizations that can leverage what they have to their benefit. And we want to be a resource for researchers to be able to do that. And also for the goal really is, my passion is doing university or fostering or helping facilitate university inreach instead of university inreach instead of community outreach, which is so that community stakeholders can identify people and talk with people at Wayne State University that they can email, because I have a phone for the university at home, but I do have an email. And the goal is so that you know somebody to ask the question and say, well, you do health communication and Carrie, and you're in gerontology and late old age, and maybe that's not helpful for me particularly, but that you see people that work at Wayne State University you've made a connection with, or you have an email address for, so that you can reach in and find out how to leverage the resources to your best benefit. That really is a central goal of community engaged work at Wayne State University. And just to point out a few important things that we heard today, I just cannot stress enough how important it is, whether you are a researcher or a community stakeholder. We have a long way to go, but I get so excited that we're there. I know when I started in this work 15 years ago, I talked to people on both sides, community stakeholders and university researchers, and it was a lot harder. We didn't have a lot of the resources we have now. And so it's not perfect, but we're getting there. And I think we're headed in the right direction. The thing I would always say to researchers, and that I want to stress, is visiting those websites that we shared in the very beginning, there are some great tools there, including the science of communicating science. That's its own science, and how you're presenting information, and not just language, which can be very complex, and we want to use tools to check our reading levels, but also visual aids, and not just the terms and the language, but if you're, presenting really complex graphs that go over people's heads, they're not getting anywhere, right? So there are some great tools about how to present your science in a way that will work to move things towards improvement. And that will continue to populate those resources and continue to build those ongoing. And I just am so appreciative for the expertise and the examples, because if we, if Hillary and I decided that we were going to give a presentation on how to engage researchers, build the bridge between stakeholders and science, it would be a lot flatter, a lot less rich. And so it's so important. Our job is just to help pass the mic to people that actually we can learn from. I learn every time I do these, and I'm just so grateful. We're all in organizations, university outside of it, which are stretched, and we're all really doing a lot. And so I just have so much gratitude for everybody that made the time to be here, including our panel, and everybody that drove, parked, came in. There's more food. And special thanks to Radlisha Sneed, who is our online moderator for the online community. They did some speed networking while we were talking and chatting, and they didn't get the benefit of the food, which you missed, but maybe next time. And I also just want to plug our next event. We will be hosting, I think annually is the goal, although with COVID, biannually, a community engaged research symposium, which we changed to a summit. We've changed the language because we heard symposium is not a great word. Why don't we call it summit? That's what we call it now. Lisa's nodding her head, yes. And that will be in the fall. And the goal of that event is to share some about our projects, upskill, do some agenda setting, sharing the progress we made since last year. Rick Zimmerman is actually the chair of one of the working groups that came out of last year. So we want to hear about the progress we're making, but also innovate and talk about where we're headed in the future. So if you're part of our newsletter and you learned about this event, you'll probably hear about that in your emails and the constant contact that Naya and Alex, Naya goes like this, Alex writes and distributes. QR code, check your QR codes and take this little piece of paper with you, because I wasn't able to access the internet in here, so you can take this home and check out all of that too. And finally, I just want to give a round of applause to Alex and Naya, who helped make all this possible. So it's 7:59, so our work is done here. Thanks to everybody online for being here, and enjoy your evening.